Hey everybody, welcome to Pick Dr. Osborne's Brain. If you are new to the show, the name of the game is type in your question. I'll do my best to get you an answer. Now, if you missed earlier this week on Tuesday, our show on B12, make sure you go back and check that out. It's full of fantastic information that'll help you navigate the ins and outs of the symptoms, side effects, drugs that deplete vitamin B12, how it's absorbed, and just give you the knowledge and the background for how you can make the best decisions about how you should be handling or taking vitamin B12. So let's dive into your questions. Um, so let's see here. Phoenix says cyanocobalamin injections and methylated sublinguals caused anxiety and insomnia. No hydroxycobalamin injections near me. What should I do? Consider using a lozenge of hydroxycobalamin. Phoenix. There's a product that we actually have at Gluten-Free Society called hydroxycobalamin, very specifically, and it's got a different form of vitamin B12 that is typically much better tolerated if you do have that side effect profile of reacting to methylcobalamin. It's not common, but some people have that increased anxiety or increased energy to the point it feels like anxiety, even sometimes trouble sleeping with methylcobalamin. And generally speaking, too, and we see that type of problem, a lot of those people are being either exposed to environmental toxins such as mold, or they're eating foods that they're having reactions against, and so that increased methylcobalamin can actually drive detoxification in a quicker manner, creating potential side effects for those individuals. So you might also want to get checked out in terms of food allergies, food sensitivities, and potentially environmental issues. I'm going to drop a link for you, Phoenix, on, let's see here. I'm going to drop a link in the feed if you're there, and you can see this coming in from me. Sorry, I'm flying solo today. My tech team's not with me. But you should be able to access that link and check more out about vitamin B12 in the hydroxycobalamin form. Okay, let's see here. Can you touch? So Honeybee's asking, can you touch base on pernicious anemia and false elevated lab reports, proper testing and symptoms? So pernicious anemia is an autoimmune condition. Typically, you have an autoimmune reaction against the intrinsic factor, either the parietal cells in the stomach that make intrinsic factor, or an autoimmune reaction against the intrinsic factor itself. Those things can be measured with specific antibody testing. If you ask your doctor, your insurance should cover the test should you suspect you have pernicious anemia. Generally speaking, people with pernicious anemia do not respond well to oral supplementation of vitamin B12 unless they're taking a sublingual, something that dissolves and absorbs through the cheeks and bypasses the stomach and small intestine. Because vitamin B12's organ or mechanism of absorption requires intrinsic factor carriage into the small intestine, oral supplementation just won't be that effective. This is why injections exist, and this is also why sublingual lozenges can also be more effective. And if you watch the show, I actually talked about studies comparing injectable to oral sublingual versions of vitamin B12, and the effectiveness is pretty equal. It's actually pretty consistent on both. So if you don't like stabbing yourself with a needle repetitively, you might consider sublinguals and see if that works for you as well. But back to the question at hand. So symptoms of B12, very common: anxiety, fatigue, shortness of breath. You wake up exhausted even with a full night's sleep, are very, very common symptoms that people report with anemia, and that's B12 anemia, whether it's pernicious or whether it's non-pernicious anemia. And as far as the iron mimicking B12 deficiency, well, iron deficiency can cause a different kind of anemia, and when you're anemic, it feels very similar, right? Because anemia is, in essence, you're not able or capable of delivering efficiently oxygen to your tissue. And whether that's being caused by B12 or folate or B6 or iron or copper or zinc or vitamin C or vitamin E, it all feels the same. So to answer the question, can iron deficiency mimic B12 deficiency? Yes, in some ways, although they also have differences as well. For example, B12 deficiency that's there long enough will generally tend to cause neuropathy in the distal extremities. So you might develop numbness and tingling in the toes and the hands as a symptom of vitamin B12 deficiency, say, versus iron deficiency anemia. My friend who has neuromyelitis optica has now also been diagnosed with bronchiectasis. Are the two related? And what is it and what she can do about it? I mean, I think ultimately she needs to talk to her doctor or visit with somebody who maybe has a kind of a similar philosophy that we do. And if, she wants to set something up through the practice, she could always visit us at origins.healthcare and learn more about our practice and how we do things. But ultimately, with a disease like that, it's an autoimmune. And there are some relationships, although they're not direct relationships. But it's not something, in my opinion, it's not something somebody should mess around with. You definitely want to get the right help. And I'm going to drop a link here. We get the question every show. Does Dr. Osborne do consultation? The answer is yes, we do. And I just dropped that link in where you can learn more about specifically about my practice. Let's see here. So this question, very, very similar to the last one from Sabrina. Can you address or go over vitamin B12 connection to iron deficiency or iron deficiency anemia? So the number one connection, Sabrina, that I see in several decades of clinical practice is that very often when people, and this is especially true, people who don't eat adequately, and when we talk about iron and B12 together, the number one food source of both iron and B12 is meat. And there are a lot of people that choose to be meat-free. And so there's a higher risk for the development of a B12 and iron deficiency in those individuals. So there's a connection with the diet for sure, in terms of, is a person eating adequate quantities of those things? There's a lot of connections, but diet's definitely one of them. Another connection is that how iron and B12 are absorbed. In my experience, iron and B12 are two of the top 5 deficiencies we see in gluten-related intestinal damage. So where gluten impacts people very frequently is in the distal small intestine, which is where iron and vitamin B12 are both absorbed. So these two nutrient deficiencies are very common and coincide together in many people who are gluten sensitive and don't know it. And they keep eating gluten, and it's damaging the intestine, and it's reducing their ability to absorb iron and B12. And then over time, they develop anemia. Now, as far as the anemias and the symptoms, what are the main differences? As I mentioned earlier, with B vitamin deficiency anemia, B12 deficiency can cause neurological symptoms to begin to manifest because of B12's role in the myelin sheath in producing the substance that coats or insulates the nerves. And so when that starts to deteriorate, neuropathy will set in. Outside of that, there's some labs that can be done that will help better differentiate between an iron versus a B12 or both. Some people, everybody's entitled to more than one problem, if you get the gist. So one of the best ways to look at iron is to ask your doctor to measure an iron panel, and also to measure ferritin, and also to perform something called a CBC, a complete blood count, and where you're looking at things like hemoglobin, hematocrit, MCV, MCH, and MCHC. These are markers that help to delineate between iron deficiency and B12 deficiency. Then there's also actually measuring directly for B12, and there's serum B12 testing that can be done, but it's very inaccurate and oftentimes misleading, because you can have a deficiency of B12 but have normal serum levels. And so the best way, in my opinion, to get B12 measured is through what's called INA, intracellular nutritional analysis, where you're looking at the outcome of the cell's ability to function based on whether or not it stores adequate vitamin B12. It's an outcomes test, and it's a much more accurate way to determine whether or not B12 is low. Interestingly enough, I get myself and my family tested every 6 months, and my wife's results just came back this morning, actually, as they came across my desk. She had been having more fatigue of late, unexplainable because our diet's clean, but she had actually developed a vitamin B12 deficiency. And so today when I go home, I'm taking her some methylcobalamin to start using right away to get her energy levels back up to where we know they should be. Okay, so hopefully that gives you some clarity around iron and vitamin B12. You might also benefit from watching. I have a crash course on iron deficiency, and also if you haven't already watched Tuesday's show, that crash course on vitamin B12 might be helpful for you. Let's see here. Okay, so another question on the B12 testing. Is the B12 test we do in the doctor's office adequate? No, those tests can be really misleading. I see it all the time. I mean, you could have eaten a high amount of B12 the night before, even supplemented the night before going in to draw your blood, and you're going to get an artificial elevation. You can actually make B12 levels look really high by being on B12 supplementation for just a couple of days. The half-life of B12 in your blood is about 6 days or so, and then your liver also stores B12 up to about 18 months of B12 storage. This is what happens for a lot of people following a plant-based diet. Is initially they feel really well, and then as time goes on and they're not eating enough B12, and that risk of deficiency goes up and it starts to set in. It can take a year and a half for some, and that's because the liver can store B12. One of the reasons why B12 serum tests are so inaccurate is because when a person's not getting enough B12, the liver will actually kick B12 out of its storage into the circulation to basically supply B12 to the body when diet is lacking. There's a name for this. It's called liver redistribution of B12. So blood serum testing is a very inaccurate way to really understand whether or not your body needs more B12. It's a common test that some doctors will run, but unfortunately, it's just not the most accurate way to assess. Now, another surrogate marker for B12 that you could ask for is something called methylmalonic acid. Methylmalonic acid elevations are indicative of vitamin B12 deficiency. And then there's another marker called homocysteine, which it can be, if it's elevated above 9, it can be a sign of vitamin B12 deficiency, although it can mean other things too. Homocysteine elevations can be there if you have a kidney problem. It can be there if you have a folate deficiency or B6 or B2 deficiency. So it's not just specific for vitamin B12. Yeah, so is sublingual methylated B12 easier absorbed by the body than methylated form of vitamin B12? Yes. Sublingual is by far the superior way to take B12, especially if you have any history of celiac, gluten-related disorders, intestinal inflammation, if you're taking or have a history of taking medications that block stomach acid, things like Nexium or Prilosec or Zantac, or even over-the-counter antacids like Rolaids and Tums. These all deplete vitamin B12 because they suppress acid, and you need acid to absorb B12. But in the lozenge form, the absorption bypasses the stomach. So the lozenge form is a superior way to take it supplementally, especially with that history of any kind of gastrointestinal problems. If taking a high dose of vitamin C, how far apart do you dose the 1,000 milligram doses? A couple of hours is sufficient, 2 to 3 hours. In theory, can psychosis from B12 deficiency be reversed? Yeah, no, it can be reversed. Now, what can happen, Dennis, if somebody lets it go for decades and they have a severe demyelinating issue, that's not coming back overnight. I mean, it's going to take time, but and some of the damage could potentially, theoretically, be irreversible. Although I don't like to start any conversation out with taking somebody's hope away, because I believe the body can heal, and oftentimes, even despite our best efforts to negate that. Savannah's asking a pretty it's a biased question for me. She says, "What's the best vitamin company you suggest?" Mine. Go visit glutenfreesociety.org. There's a shop there, and we have over 100 different pharmaceutical grade nutrient supplements that you can take and use and read about. But hands down, there's no doubt in my mind that our company's the best, that we source the best. We don't allow garbage fillers or GMO nonsense in any of our products. We have very, very restringent testing methods to ensure that our products are what they say they are, and that they're not contaminated with other things, and also that the expiration shelf life of our products is actually above and beyond what's required by the FDA and the GMP. So I'm biased that way, but I've been in the supplement industry for over 24 years, and I've been a major formulator for many famous companies that you guys have all probably heard about. And many of my formulations are used around the world by other companies, but I have my own company where we do the best of the best work. Which B vitamins produced by intestinal bacteria are poorly absorbed by the intestinal tract? Well, no B vitamins are poorly absorbed by the intestinal tract. It's not that the intestinal tract is broken and doesn't work and won't absorb. It's that what has been done to the intestinal tract by the owner of that GI tract. I mean, your gut health is a reflection of what you put in your mouth and what you expose your body to environmentally. So it's not a problem of the intestine being ill-equipped for that absorption. It's more a problem of what is that person doing to themselves. So maybe if you have a different question in mind, you could clarify, but that it's not a problem in the gut. It's a problem in the human's choices around it. Let's see here. From what it seems, with liquid B12, where you take a dropper full and drop it under the tongue after keeping liquid without swallowing, almost nothing visibly gets absorbed. What to do? It's you won't see it being absorbed. The liquid's not going to dissipate under your tongue, Michael. The B12 molecule itself is going to be absorbed by the buccal mucosa. So it's not, you're not going to see physical absorption of B12 occur. And make sure if you're using a liquid, I've looked at many liquids on the market. The vast majority of them contain corn-based fillers. So be very, very careful if you're trying to stay with the no grain, no pain diet. If someone's homozygous MTHFRCT with extremely elevated homocysteine, any ways to tell prior to supplementing if they adversely react to methylcobalamin and methylfolate? No, because generally people with MTHFRCT mutations do really well with both methylcobalamin and methylfolate. So it's not something, there's no test that really can identify how you're going to react or respond. And two, if you have that mutation, you most likely will respond quite well to both methylated versions of B12 and folate. So, I mean, that would be that would be something I would encourage you to look at more if you haven't already supplemented. Will sublingual B12 give you noticeable increased energy shortly after taking? For some, yes. I mean, some people report an increased energy, especially those that are anemic within hours, and some within days and others within weeks. It depends on the person and level of deficiency that's there. But as a general rule of thumb, we generally guide people clinically to say, look, if you're supplementing with vitamins that you're deficient in, as a general rule of thumb, it takes about 2 months for the effects to really start to kick in. It's not a fast game. It's generally not always, but generally it's not like a drug that works within an hour. It's the slow, steady pace that gives your body the tools that it needs to heal, repair, and run the engines of metabolism. If B12 is deficient and you supplement, how soon would you start feeling better? Again, generally within a couple of months, you would start feeling better, both from a fatigue perspective, if that's what was driving it, and from a headache perspective, if you were having B12 deficiency induced headaches. I mean, one of the common side effects of B12, neurologically speaking, is migraine headaches. So those of you that struggle with migraines, and that includes visual migraines and auditory migraines, but also just the classic, extreme pain migraines. So B12, very, very important in that regard. And a lot of people notice tremendous improvements within a few months of supplementation. And let's see here. A friend who does not have her taste back from COVID, and it's been 4 years. What would you suggest? If her taste is still gone, I would suggest a combination of quercetin and zinc. Excuse me. That combination, you need zinc for taste. Zinc is a primary nutrient involved in the gustatory mechanisms of being able to taste and smell, for that matter. And a lot of our taste is what we smell, actually, more so than our tongue. But zinc, depending on your friend, but a good place to start, 25 to 50 milligrams a day. Sometimes we go higher, even as high as 125 milligrams a day. Quercetin, anywhere from 1 to 5 grams a day, or 1,000 to 5,000 milligrams per day, in combination for a solid month to see if that brings her any changes. That's what, if she were in my practice, that's probably what we would, somewhere in that neighborhood of what we would give her. My fibromyalgia started after 3 jabs in a 9-month period of time. How can I undo the damage? I mean, I would suggest going to a good functional doctor and getting tested. A lot of people that have those types of injuries, one of the reasons they can develop those kinds of injuries is in part what they did, but in part also what was their health before doing it. And so vitamin and mineral deficiencies can play a role in that long term. Heavy metal potential toxicity role in that long term, and then even how you're eating specifically. We see a lot of that when the immune system gets primed by an adjuvant, that people can develop reactions to food and allergies to food. It can open up the gut, creating a leaky gut situation, and create kind of an over hyperreactive immune system. And that all needs to be addressed and looked at to calm that immune system back down. Can I take too much B12? I started shots and they have been life-changing in 1 month. The doctor didn't even want to order me B12, so I had to pay because I didn't fit the criteria in Canada. Yeah, I'm sorry if you live in Canada. The doctors there, and at least from my experience, not all of them, but many of the people that I've seen that have come to me from Canada, their system over there is just not very good. You get mediocre doctors and long wait lists. Well, that's true in America too, but it's probably true of any major European country where pharma's got its tentacles into the puppeteering of what goes on in hospitals and doctors' offices. The question Laura's asking is, can I take too much B12? Yes, you can take too much B12. Generally speaking, anything in high enough quantities over a long enough period of time can start to become toxic. So you don't want to just nilly-willy just jam yourself with as much as you can get. If you're feeling really well with just standard dosing, I would just stay that course. And even if you have to pay out of pocket to monitor the level until you get solid an answer as to whether or not your levels are adequate. And to make sure you're eating B12, right? Because it's not, in some cases, it's malabsorption, it's pernicious anemia, it's gut damage that leads to this, right? Or it's the wrong diet style. And so you can eat B12, right? You just have to get it, you have to eat meat. That's just the nature of that beast. Now, if you have a healthy microbiome, there are certain bacteria that can produce vitamin B12. And so this is kind of one of the reasons why some people going plant-based don't develop a B12 deficiency, because it's not 100%. It's not like everyone on a plant-based diet is guaranteed to have B12 deficiency, but the odds and the risks go way up. I recently did a video on B12 and how frequent plant-based people are found to become vitamin B12 deficiency, and those statistics, you can go check that out on my YouTube channel. Do you think that B12 and B vitamins in general could make a parasite infection any worse? No, not typically. I've not seen that be the case. And Heather, I'm of the firm opinion that parasite, there's a whole laundry list of influencers out there that are trying to sell parasite packages. And their claims are everyone has a parasite no matter who you are. And that's just very frankly bullshit. Not everybody has a parasite. And the other component to that is let's just say that hypothetically they're right. Let's say that everyone has a parasite. Here's what we don't know. Just like with bacteria, we don't want to damn the entirety of these microorganisms over fear. We did that with antibiotics, and that's what panned out over the last 50 years is antibiotics are dispensed like candy. The consequence to that has been the destruction and deterioration of human health as a result of basically disrupting the microbiomes of hundreds of millions of people. And the consequences to that is autoimmune disease, is chronic autoimmune disease. So we need bugs. The question mark around the whole parasite thing is, are there certain parasites that are friendly? There are certain ones that are helpful, that are part of our microbiomes, that are normal. And so in that regard, I think this whole go to war against everything that isn't human in your body is a foolish belief, and it's a pipe dream. And that's not to say that parasite infections also don't exist. I'm not saying they're not a reality, but in my career, I've probably done 50,000 analyses investigating for parasite in many different ways. And there's cultures and there's microscopies. There are different lab tests that we look at to help identify whether or not potentially somebody might have parasites. And there's nowhere near the prevalence that a lot of people are out there saying there is. And again, that's not me saying that if you had one and been diagnosed with one and had a good experience with any parasitics, not trying to if you're watching the show, and I'm not trying to say that they don't exist. I'm just saying that the statement that everyone has parasites and that parasites are a problem for everyone is nonsense. And going back to, I know I got off on a tangent there. So going back to the question at hand is, do B vitamins make them worse? In my experience, absolutely not. They do not. Let's see. Why does MTHFRCT in blood work come out low? MTHFRCT, that stands for mean corpuscular hemoglobin concentration, and it's a measure of the quantity of hemoglobin concentrated inside of the red blood cells. And one of the biggest reasons it can come out low is an iron deficiency. That's a possibility. Now, other things can cause low hemoglobin concentration as well. Vitamin B6 deficiency, copper, and zinc can also contribute to low MTHFRCT. There are also certain types of blood dyscrasias that can contribute to that. So it depends on the person and the rest of the scenario around it. Do you analyze genetics when analyzing a B vitamin deficiency? I can. It's been my experience when I was. This has been 20 years now. I had worked with a company in Colorado called Siona Genetics, and they were in the process of developing genetic SNP testing based largely on a lot of the work done by Bruce Ames. And so they came to me to consult with me about that test and its, one, its development, and two, its use clinically. And so we used that genetic SNP testing for, I'd say, probably about 4 years clinically aggressively, meaning we did a lot of analyses on people. And what we came to find was that when you knew somebody had an MTHFR or MTR or an MRR or a COMT or MAO or any of these other common genetic variants that are commonly discussed online, that if you were to supplement those individuals based on their genetics, the outcomes weren't fantastic, meaning that just because you have an MTHFR mutation and take folate doesn't magically make your health better. What we found in our data was the clinical outcomes by looking at genetics and supplementing genetic SNPs was mediocre. And it's not to say that there weren't cases where some people felt amazingly better. There certainly were, but I'd venture to say that was more like 90%, 10. Like 90% of people supplementing their genetics did better, 10%, not much of a change. And where we really moved the needle clinically in individuals, regardless of their genetics, was when we looked at their behaviors and we modified their behaviors based on their biochemistry. And what I mean by that is we measure different things in our clinic. We measure 4 categories of things as a fundamental basis for a starting point. One, we measure nutritional deficiencies directly. So instead of measuring the gene predisposition to nutritional deficiencies, we actually measure the deficiencies. Number 2, we measure food reactivity, because if a person is not willing to change their diet, there's very little that anything is going to do supplementally long-term to help them overcome a bad diet. Number 3, we look at their microbiomes. We assess the critters, if you will, that live inside them, and try to better understand what's going on from that perspective, so that if we need to help them navigate that, we can. And then number 4 is we measure for toxin exposures and reactivity. And so by changing their choices through their own biochemistry, what we find is that it's really oftentimes irrelevant what a person's genetic SNPs are in relationship to B vitamins or any other nutrients for that matter. It's not to say it can't play a role. It's not the thing that I would look at initially as the primary tool to help me guide somebody down the right decision matrix to improving their health. Which creatine do you recommend? I recommend the one at Gluten-Free Society. So we have a product called Ultra Creatine, and this is a pure crystalline form of creatine without all the hype fillers. A lot of products contain the different sweetening agents and the different we'll just say fillers for texture, taste, and mixability. All that's nonsense, and it's not good for you. Pure creatine is what you want. And so that's what we recommend. I'll put a link for you for those of you interested in just pure, unadulterated creatine. You just mix 5 grams a day with water, and it does not dissolve in water. So you swirl that water around, and then you kick it back really fast so that you get it all in. Creatine it's not water soluble. Let's see here. Love hearing these comments. No, these never get old. Thank you, Larissa. Larissa says, thank you for everything you do. Your book was a game changer for me. I love hearing that. Anyone else on the show today who has read or listened to the audible version of No Grain, No Pain, and it altered your life in some way to the positive? I'd love to hear from you. We love these stories. Our mission, for those of you who are new to the show, is my goal in life is to help save 100 million lives through advocacy and education freely. And we do a ton of free education. We have over 2,100 YouTube videos on our channel at this point, thousands of hours of free information, because we believe that the way to help the world is to empower the world so they can make better decisions for themselves, not to co-opt their decision-making capacity as a lot of mainstream medicine would have you do. They want you to do what they say, and they don't want you to ask questions. And anytime you're not allowed to ask questions, that's the time you run away. That's why I do these live Q&As. I mean, how many questions have I taken over the years? Ad-libbing. I don't have an encyclopedia here next to me. I just share with you guys what I know, share my experience both clinically and personally, and hope that it's making a difference in the world. So if it is, I appreciate you letting me know. Let's see here. Have you worked with people having fertility issues all the time? I mean, I don't want to proclaim to be a fertility doctor, Diana. I'm not a fertility doctor, but when people oftentimes come to me, they're so malnourished they can't conceive, and just by the nature of changing their diet, lifestyle, and nutrition, their bodies are now able to conceive. We've fostered I don't know how many babies that have helped come into this world as a result of nutritional treatment, but I stopped counting 15 years ago, and the number was over 100. So I know we're responsible for hundreds, if not thousands, plus babies being born through better nutrition. I hate to hear that your daughter's friend has had 3 miscarriages. So I've got, let me see if I can pull it up for you. This might be helpful. Years ago, I was hired by a company to put together a research-backed diagram on infertility and nutritional deficiencies, and so I think they got mad at me because it was such an extensive piece. They weren't expecting something so robust, and I'm going to post it up for you guys here. I'll put the link into the feed. I'm going to just label it infertility diagram and just share this with anybody that you know that's struggling. It goes through and it breaks down the different vitamins and minerals and how they impact fertility and how they impact a person, both male and female, a person's ability to conceive and carry a healthy child. With miscarriages, a lot of times, I will say this, that the blame oftentimes is put on the woman, but a lot of miscarriages are not the woman's fault, they're the man's fault. You know, a lot of times we see the women change their diet, and we see the women do a bunch of things in an effort to get ready for pregnancy, and a lot of times the man just sits over there not doing anything and just takes a passive role. But any man worth their salt needs to get their shit together, to be very frank. I mean, you're about to give life to another human, and 2, you've got to be an example. That means you should be fit, you should exercise, you should eat well, because those are the things that are going to be expected of you as a parent to impart to that child. If you're going to expect that child to have success in life, it's your obligation. And if you're not willing to do those things, you don't need to be a parent. That's maybe a little harsh, I know, but that's just the way I stand on it. I just think parenthood is too important. We have a lot of really crummy parents, and there's licenses for everything in our culture. You have to, like, to do what I do, you have to have a license. To give a haircut, you have to have a license. To drive a car, supposedly you got to have a license, right? To be a massage therapist, you need a license. to be a plumber or an electrician, you need a license, but to be a parent, you don't. And, not that I want the government involved in having to give out licenses for people to have the freedoms to be able to have a child, but, take it seriously. Take it as serious as you would with your profession or anything else that you would value as near and dear to your heart. I got your vitamin D3 liquid, and it also triggers a migraine. I don't know why. That's pretty rare, Carolina. But it does happen. There's what we call kind of a non-regular type of side effect that can occur, and it can happen with any supplement. Different people have different responses, and sometimes it can have to. If you bought the liquid D3, it's in a base of sunflower oil, and so you might have a problem with sunflower directly and not necessarily vitamin D. The other option would be to use a crystallized version of vitamin D without the oil. It doesn't absorb as well. The oil actually emulsifies the vitamin D and helps its absorption. That's why we put it in there. But some people react to those oils, so going with a pill version of a vitamin D might be a better option for you specifically. I've recently been diagnosed, although I've had symptoms and low blood counts for years. Now I'm wondering the symptoms of excessive hunger and anxiety could be related to anemia. Yes. When you're anemic, you're malnourished, Isabel. And when you're malnourished, your body is smart. It's going to send hunger signals. And anxiety is a very common symptom of anemia. As a matter of fact, it's probably one of the most common symptoms of anemia that gets misdiagnosed. A lot of times when people have anxiety, the doctor says, here's an SSRI, or here's a pill, or go see your psychiatrist, or go get couch therapy, or go do yoga or meditation or mindfulness. But in reality, no amount of those things are going to fix an anemia that's driving anxiety. Anxiety is a very common symptom of anemia. If B12 stays in your system 6 days, I take Superior Source bilingual tabs. I wonder why. Should I just take it once a week? No. It'd be like saying, should I just eat food with B12 in it once a week? Therapeutically, it just depends, Tanya. If you're taking it and you're not really deficient, but you're taking it as a supplemental, just as something you're trying to be preventative around, yeah, maybe that wouldn't be a bad strategy. But if you're trying to correct a vitamin B12 deficiency, what's a therapeutic dose? We look at the ranges of dosing, right? We look at B vitamins. For B12, when I say therapeutic, I mean what's effective clinically to correct a deficiency in somebody who might have malabsorption problems. And that dose ranges from anywhere from 2 to 20,000 micrograms a day. And so, it's different for different people. We generally start people between 5 and 10,000 micrograms a day to correct B12. So, take that into the context of the question that you asked, and maybe that helps you. Is there enough B12 in a good multi? In a good multi, there's enough for kind of daily maintenance, but there's not typically enough therapeutically to correct a bad enough deficiency, Yvonne. So if it goes back to, if you're in a deficiency state, a multivitamin's not, although it's helpful in many ways, it's not the solution to correct a B12 deficiency fully. Have you seen anyone who started getting worse autoimmune symptoms, red dots and patches on the skin due to breast implants? Yes. Several people. Breast implant illness is very real. One of the things, and I posted, this is a very unique story. Another person had shared their story. It wasn't a patient of mine, but her story was so compelling, I wanted to share it with more people. But it's a woman who had breast implants, and she, shortly after having them put in, she got very sick. And anyway, she had them removed, and when they pulled them out, there was mold growing in the implant. And so in her case, the implants, when they surgically embedded them, there was a contamination issue in the surgical center, and it caused mold to grow in her implants and made her extremely sick. Now, there are other people that react to the implant itself, and it's not necessarily mold in the implant. But when you say autoimmune symptoms and red dots and patches on your skin, those red dots, one of the things we see those red, if you're talking about a cherry angioma, very, very commonly associated with mold, because there's specifically there's a type of mold called Fusarium that generates a toxin that emulates or mimics estrogen, and that excess estrogen mimicry leads to those red dots to form. So that may be part of what's going on there, and it may just be the implant itself, but I would certainly get it looked at. I don't understand implants. I mean, I do from a vanity perspective. I think every human has some degree of vanity. I do. And so I can kind of understand it from that perspective. But the popularity of these things, I know largely driven by youth and just drive, but they're just not necessary. And they create such havoc and harm, in my opinion, especially when it goes wrong. If it doesn't go wrong, it's still creating harm over the long haul, in my opinion, with the chemical reactivity potential. But anyway, I'll get off that. What type of creatine for an autistic child? Same one I posted up a moment ago, Tanya. It's in the feed. I put a link up to creatine. Same type, just pure creatine. 5 grams a day is a standard dose. Very safe dose for for children and for adults. Can you do a live on your supplements? I should break it down. I'll tell you what, that's a great question. What I would like to see is those of you watching right now, if you would like to see me do a live and go through the supplements from Gluten-Free Society, just type in supplements. If there's enough interest in doing it, I'll put the effort in for you guys. The copper on your body do anything? You mean like a copper bracelet or a copper lined fabric? Copper can. It actually has electrophysiological properties that can improve or increase blood flow. There's some pretty good research on copper. I think one of the companies, and I don't work for these guys or get paid by them, but one of the companies that was doing a lot of copper products is called Niken or Niken. I don't remember how to pronounce it, but there's some pretty good research around copper. I'm not a fan of using wearable things to address symptomatic problems that you should be making changes in your diet and lifestyle to fix. And just simply because copper just becomes a different kind of aspirin, right? Aspirin, we take aspirin to treat pain, but why do we have the pain? I mean, that's fundamentally the better question to ask. And so asking that question allows you to not need the aspirin if you solve the riddle, right? And it's the same thing with a lot of people that wear copper devices. So it's not to say they can't be helpful. It's just simply to say, what are we doing? Are we trying to mask our symptoms with devices and pills, or are we trying to be smarter and look better and be a better steward of our health through education and empowerment? Love this story. Robert says, after nearly 2 years of sciatica and growing numbness in my right foot, fuzzy mindedness and insomnia, I was diagnosed with low vitamin B12, started taking triple dose of vitamin B with 100% recovery. Thanks for sharing your experience, Robert. I know other people are watching and reading, and that may give them the courage to do that. I like this story too. So my friend had 4 miscarriages. I showed her a research study about how gluten can affect fertility and increase miscarriage risk. She quit eating gluten and add progesterone. She finally got a girl. Congratulations to your friend. That's wonderful. Let's see here. Do you recommend melatonin? Sometimes, but it largely depends. Where I like the use of melatonin is not in the day to day for sleep, because again, usually when somebody has sleep disruption, it's it's solvable. We can figure out why, and then we can take those corrective actions and typically not need melatonin. Now, where I might recommend melatonin would be somebody who's so sleep deprived and the benefit of sleep outweighs any kind of risk. Not that melatonin is so dangerous, but ultimately, your body makes melatonin through optics, right? Through sunlight exposure to the optic nerve, and we want to tap into that more than we want to take it supplementally. But sometimes people are struggling so much in sleep that the benefit of the sleep outweighs the detriment potential of using melatonin. The other time I like to use melatonin is when I travel, especially if you're traveling like overseas or through multiple time zones. Melatonin can be fantastic to kind of get you adapted to the time zone that you're going to, so that you don't crash when you get there. If someone's been hypothyroid most of their life and told they must now take synthetic hormones because thyroid function is never coming back, is that true? No, it's not. Um, Look, I'm going to have a different opinion, obviously, Don, than maybe the endocrinologist, because I hear that all the time. People that come to see me, they're like, my endocrinologist told me this wasn't fixable and that I needed to be on the medicine. I want you all to kind of let this statement sink in. When a doctor says to you, you have a disease, and then also proceeds to say to you that we don't know why this disease happens, but then also proceeds to say, but you need to take this synthetic drug for the rest of your life and that your disease will never go away. That's an oxymoron, right? It's a contradiction of terms. How can they, with one side of their mouth, say you have a disease and we don't know why, and then out of the other side of their mouth, with such great degree of confidence, say this disease will never go away and you always need to be on this medicine? If they know so little about the disease, how do they know so much about the treatment and the future? And the answer is they don't. It's a fear tactic for compliance. There's a psychology that oftentimes is used clinically, and I don't agree with it. I don't agree with using fear to encourage people um, to make change. Now, sometimes by educating someone, fear happens, in which case I'm happy to educate a person. And if by educating them about a particular topic, it puts fear in their heart to empower them to make meaningful changes to reduce the risk of something that might happen to their health in the future, then so be it. I'll use education all day long. And if the outcome of education is that fear, then that's not using, at least in my ethical and moral compass, is not using it incorrectly. But what I would never do is coerce somebody using fear and lack of knowledge to get them to make the decision I wanted them to make. I believe in free will and free choice, no matter who you are, no matter what you want. I have patients, and I respect many of the patients that come to see me are vegans, and they're vegans for spiritual reasons or religious reasons. And I'm not trying to get them, I'm not going to try to scare them into eating meat. I'm going to be honest with them, and I'm going to share the data that we have and that we understand about that type of diet. And I'm going to explain to them the type of testing they should probably do and the type of supplementation that they should probably look at doing. But I'm not going to try to coerce them into making a decision that they may not be comfortable with or come to regret later because I thought it was best for them. I mean, I think that's, part of good bedside manner and just good ethics is just respecting the freedom of somebody to be able to make the choice for themselves. And I don't look at the doctor's job as dictatorship. I look at the doctor's job as an educational relationship to guide somebody to a better understanding the decision that they need to make that's best for themselves. And if you have both sides of the equation, if you know the risks, you know the benefits and everything else, then you as the person can make your decision, not the doctor. And then therefore you can own that decision. Like, life's hard enough making decisions for ourselves sometimes, that we would want to outsource our decision making to another person explicitly. And I think that's what's happened in medicine to a large extent. Doctors have God complexes and egos that they're so blind by their ego, they're not willing to learn from the patients who are responsible for teaching them. Remember that ultimately the practice of healthcare is a practice. It is that we don't use the term perfect, because we're not. We practice every day. We try to get better. We listen. We have an open heart, an open mind. We read. We educate ourselves. We learn more. We experience more. We do more. But ultimately, we listen to our patients, because the best teachers are experiential teachers, and that comes from the interactions, the human-to-human interactions, and the outcomes. Isn't the Fusarium bacteria that they are studying? So it's not Fusarium bacteria, it's Fusarium mold. And yes, there's evidence that that particular type of mold and the mycotoxin it produces increases the risk of certain types of cancer. What do you recommend for brain improvement and memory? I think a human brain is going to be responsive to human interest. And if you are enjoying your life and enjoying what you do and have an inquisitive mindset and strive to learn and strive to challenge your brain on a regular basis, I think that's the number one thing that you can do, is just in your behavior. And that includes your memory as well. Now, if you do all those things and endeavor for all those, and you're finding yourself foggy and still struggling, I would look at, number one thing I would recommend that you do is get a micronutrient test where you're looking at your vitamins and minerals, because sometimes simple vitamin deficiencies, nutrient deficiencies, can impair the brain's ability to function fully. I see it all the time. Probably some of the most common are B vitamin deficiencies that impact the way the brain works. We also sometimes see low protein diets do that, especially because where we get a lot of our tyrosine, which is stimulant to the brain, and where we get a lot of our histamine can be found in meat. Or, I'm sorry, not histamine, histidine, the amino acid. What does it mean when B12 lab says out of range? Does it really mean that, or need to take an MMA test? Depends. I mean, it depends on the lab reference range that they're listing. It depends on whether or not the liver's in a mode of redistribution, causing an artificial normalization of the lab serum test. I think it's never a good idea to rely solely on a serum test to understand your vitamin B12 levels. I think if you have really low B12 in your serum, that's an honest assessment. But if you have normal, you can get false normal reports. You can get false high reports. So going back to what I said earlier, serum is not your best measurement. Let's see, you used okay, yeah, a lot of you commented on supplements. So what I always want to honor and respect is, I don't want to become a sales show where you guys are just tuning in so that I sell you things. I really want to be an educational, informative show, and so that's always just been my my hesitancy in talking directly about a product. So for clarity's sake, when I say those of you who want me to talk about supplements, I have a lot of videos on vitamins and minerals, specifically what they do and why they're important. I think for the clarity of of the answer here. How many of you want to see me talk specifically about the different products that we carry at Gluten-Free Society so that you understand them better? That, because that's what I want to try to avoid is being, I'm not a, well, we are not, or we're not telesales, we're not, what is that, home shopping network? Like, I don't want to get into that vibe. Dr. Osborne, many of my mold MCAS symptoms have gone away or gone way down. I started taking large dose biotin, BCAAs, zinc, and many others 3 weeks ago, and I don't know what did it. Can you give me some insight? I mean, so there's a lot of variability to that question. Zinc can help stabilize histamine, and so if you started taking zinc at higher doses, then yeah, it's a potential possibility that that's it. But many people also that are in mold have developed an auto catabolism. Basically, their body's eating itself because of the chronic inflammatory poisoning of the environment. And so sometimes what's very effective is giving branch chains to help with many of those symptoms. And the reason why is it allows for a better recovery. It's just basically it's giving the body some of the key ingredients it needs to repair and rebuild some of the inflammatory issues linked to chronic mold exposure. But there's so much from other variability to that question. It's really hard to answer with the limited amount of information. I know you weren't able to give me your whole history there, but it's hard to discern 100%. I have B12, 1,000 micrograms, and 400 folate. The name of the company, is this a good brand? I don't comment typically, Marika, on other brands. I don't know the ins and outs of that company. I don't know what they do or how they do it or what they strive for. I don't know their core philosophy, and I don't know who runs that place and what kind of ethics and moral compass is behind the decision making. So it's very hard for me to encourage other brands other than the one I'm the most familiar with, which is my own. Now, there are a few brands that I recommend beyond mine in my clinic setting, but I usually just don't comment, especially if I don't have something good to say about a brand. Do you have a video on PCOS? My daughter-in-law has been diagnosed, and I'm so happy I found you. Well, thank you, Laura. Thank you for your compliments. We have, I don't think we have a full video just on PCOS, but we have several on hormones. If you do a Google search in my YouTube channel for PCOS, you'll probably pull some of those clips up. But I would say this is something I think you should share with your daughter, and that is PCOS is diabetes, and it's just never diagnosed that way. Generally, PCOS, polycystic ovarian syndrome, is diagnosed as a fertility problem a lot of the times, and the treatment in medicine is the drug metformin, which is an insulin sensitizer. It basically helps insulin and glucose communicate better. And the reason why that's the treatment is because PCOS is diabetes. And so if you approach PCOS from the perspective that it is diabetes, you'll win. You'll be successful. How do we manage and control diabetes? Well, we control our carbohydrate intake. We make sure we have the right minerals to process blood glucose effectively. What I would encourage you to watch in all that regard is I do have a crash course on blood sugar and blood sugar control and the nutrition around it. And I think that would be very helpful for your daughter. And if she watches it and follows through on it, and especially if she follows the no grain, no pain diet, come back in 2 months and let me know how quickly her PCOS went away. It's not a hard thing to get rid of. How quickly can you regrow myelin with B12 supplementation? It's a huge, tremendously difficult question to answer, because myelin is not just a B12 issue. Myelin, first of all, is there an autoimmune process against the myelin? That process has to be stopped, if there is. And many of the myelin diseases are autoimmune in nature, meaning the immune system is producing antibodies that cause the destruction of the myelin sheath, and that all the B12 in the world is not going to fix that. Now, if you resolve why the autoimmunity breakdown of myelin is occurring, and that person has a B12 deficiency, and you supplement that person with B12, you're looking at 6 to 18 months for very obvious changes and improvements. But nerve tissue takes longer to heal. But understand that it's, myelin, the myelin sheath is deeper than just vitamin B12. Okay. Is there any, let's see, any treatment to recommend for prostate before going to surgery? A member of my family was suggested to do the surgery, and he's afraid of it. He should be. Look, it's hard for me to speak because I don't know all the details about your friend. But I will say this. Any man facing the chopping block of the prostate should understand this statement very clearly. Prostate cancer is not a fast cancer, and I'm generalizing here. There are exceptions to every rule, but prostate cancer is not a fast cancer. To remove the prostate, you run the risk of the complications of that, and they're not small risks. But for a man, one of the biggest risks is a complete loss of sexual function, and it's a very common outcome. I've seen it happen in many people. I've encouraged men in my own practice to not have the surgery, to rethink it, and in many cases watch several go on to have it anyway, and then lose their ability to have sex with their wife, which, some people say, well, it's just sex. No, I mean, for a man, sex is extremely important. It's for most men, it's one of the most important things in the relationship with their spouse. And so that's not a small ask, is to take that risk. So I don't encourage it, but I also don't know the details of the history. And so if we're talking about prostate cancer being a slow-growing cancer, most men will die with prostate cancer, but not die of prostate cancer, because it just is not typically something that causes a lot of problems. Once you go in and start tearing things open, and you open the risk for metastasis, and you open the risk for those cancer cells to spread and go to other places of the body, and now you can have a problem. So as a general rule of thumb, the body will encapsulate cancer in an effort to not allow it to spread and disseminate. And I'm a big believer in honoring that process and not just going and ripping out the organ because some doctor had the opinion. And prostate surgery too is very lucrative for the doctors that perform it. So there's definitely the potential for a conflict of interest. Again, I'm not damning any doctors for conflict of interest there, but it happens. I've seen it happen. Let's see here. Can prostatic hyperplasia be caused by a zinc deficiency? It can be. Zinc is a very common contributor to prostate issues, prostate enlargement. So the answer is yes. There are other things as well. Some of the biggest things we see associated with prostate issues in men, one of the biggest is diet. Highly processed food diet and gluten sensitivity can also increase that risk. So, Don, if you're not already following No Grain, No Pain, you might look at it if that's something you're concerned with. Is there something to take for pyrrole disorder besides B6, P5P? Yeah, zinc. But also, I'm also not a tremendous it's like pyrrole disorder. Pyrrole's not a disorder per se. I've not seen anyone in all my years of practice with just a pure pyrrole problem that was genetic and that B6 was the only solution. As a general rule of thumb, there's not it. When you look at pyrrole metabolism, there's multifactorial, and so it's not just about B6 either. But I also see a lot of doctors looking at pyrroles and blaming pyrrole for everything, and you have to be careful around that context too. All righty. What nutrients support the myelin sheath? B5, B2, B12, omega-3 fatty acids, choline, magnesium, zinc. There's a multitude of nutrients that go into the biochemistry around myelin. So hopefully that helps you kind of get a head start on doing some additional research on your own. Why does low random urine creatinine come out low in blood work? What does low random urine creatinine come out low in blood work? That question contradicts itself. Maybe re-ask it. Which creatine do you recommend? Okay, no, so answer that one. Sorry, folks, I don't have my tech guy here throwing the questions up for me, so I'm having to thumb through 4 different platforms to look in and read these. I like this comment. I'm gonna read it out loud. Sharon says, just wanted to say thank you. I've been working with you through your clinic online for more than a year, and my health just keeps getting better. I've taken the nutrition and mycotoxin test, following your advice. So worth it. Thanks, Sharon, for sharing your experience for others to benefit. Do you think supplements B12 is good for brain health? I don't take anything 43 years of age. Could be. I mean, it just depends. I'm a fan of testing and not guessing. That's really, if you've ever watched my show for any length of time, that's a big aspect of what I'm about, clinically speaking. And then the reason why, there's actually a very good reason why. I wasn't always that way. I've evolved to do more objective laboratory analysis over the years, simply because so many different nutrients have overlap with each other. We look at like just the similarities between folate and B12 and how they can cause poor health in people. The symptoms match almost perfectly. And that's just one example of literally thousands of examples. And so when you're trying to ascertain, should this person take X, Y, or Z, and how much and for how long, and what is the expectation, if you don't have any objective data set to go off of, then it's really highly just speculative. And what I prefer to do, just my own opinion, is I prefer to work with people who've already guessed, on themselves, and they failed. Because the people that guessed on themselves accurately are better, and they didn't ever need to call me, right? Which is great. They win, and and they don't need to have to visit a doctor. But it's the ones that are not guessing properly because they just can't figure it out. Those are the ones where I really enjoy working with those individuals, because I am such an objective practitioner and do what I would say is an extremely thorough workup around the parameters of diet, lifestyle, and nutrition. That once we have that data, it's just like drafting a blueprint for health for that individual. And to me, that helps to get us to where we all want to be, which is anybody coming to see me, I know their endeavor is to be healthy. And my endeavor is for them to be healthy. And my endeavor is for them to need less doctoring as time goes on, I mean, really, ultimately, the job of any doctor, honestly, if you write the business model for any doctor, the job of the doctor should be to fire the patient because they're so damn healthy that they don't need the doctor anymore. But in order to get there, the doctor needs to invest his resources and efforts and time on educating that patient about their own uniqueness so well that they can be empowered to make fantastic choices through the course of their life, and those choices translate into health. I mean, ultimately, that would be a win-win. But I think the problem is, and this is the problem. Some would say, well, that's why capitalism is so terrible, because the greed gets in the way. And I don't disagree. Greed can be a problem, but look at socialized medicine. There's no capitalism there, and those systems suck. Honestly, go to any country in the world with socialized medicine, and nobody's going to be raving about the quality of the stellar nature of the doctors, because socialized medicine breeds mediocrity in the career field. And so, what you get when you take away all incentivization for advancement is you get people who don't choose that career field because there's no incentivization, right? And it's just human nature, and I'm just as guilty of it as anyone else. But we all have egos, and in many cases, our ego to want to be better and want to do better and want to be proclaimed as one of the best or the best. In part, that's part of the reward. When people say, Dr. Osborne, how do you do as much as you do? I mean, we create over 1,000 hours of content a year for free. I run a clinic full time. I run Gluten-Free Society full time. I'm in the middle of a documentary. I do hundreds of podcasts a year on guests on other shows. And why would I want to do all of those things? Because there's a reward in it for me, right? We all want an end outcome of what we want. And I'm just probably one of the few that's honest about it. What's the reward for me? The reward for me is predominantly that it feels really good to help people. I love helping people, and I love the smile on their face when they show me the picture of their new baby. I love when they throw their walker down and they can walk with their own legs. I love it when they don't have to do caretaking for their family anymore because their family member's healthy. And so I've not only taken and helping that person who was sick, but also helped the person who was sick and tired from caretaking and helping. Like, to me, that's the reward, and that's the relentlessness. And I think if everybody could find that in their life, that drive, I think we live in a much better place. Let's see here. So many to dig through. What method would you recommend for someone with deterioration of cartilage and hip joints? Depends on the level of deterioration, Freya, but first and foremost, movement to tolerance, exercise, because what rebuilds cartilage and what nourishes cartilage is motion. More than any supplement you can take, more than any therapy you can do, movement is life. And the cartilage itself doesn't have a direct blood supply, but it receives its nourishment through the synovial fluid, which pumps nourishment into the cartilage through the activation of movement. So you have to move. And if you're limited because of the pain, then you have to move at first cautiously and intelligently and with design. As far as supplements are concerned, probably one of the most effective for cartilage and arthritic pain is glucosamine chondroitin mixed with MSM. We do have something called Ultra Joint or joint support, and it is got all three ingredients in it. How much sunshine a day for a normal human being? As much as you can get. As much as you can possibly get. Um, that's to say, without burning. Your skin is a battery of sorts, and a lot of people don't realize that. But in your mitochondria, they work better. So when the sunlight hits your skin, it actually enhances your body's ability and capacity to generate energy. So how much is enough? You get as much as you can every day without sunburn. That's how much. And some people say sunlight ages. It can if you go out and burn on a frequent basis, because radiative damage to your skin is not necessarily healthy. But sunlight doesn't cause radiative damage. Sunburning does. It's kind of like water doesn't cause drowning. Too much water causes drowning, right? So when it floods into your lungs and you can't breathe, that's the point of drowning. But that doesn't mean that water's bad. And I think the same analogy is true of the sun. My goal every day is I try to get at least an hour, and many times I get a lot more. On the weekends, I'm outside almost all day. So that's just me personally. I know everybody's got different schedules and lives in different climates and have different availability of that sunshine. But get as much as you can wherever you live, to the limitation that your skin can tolerate without burning. What are the best foods for the brain? There aren't any. There's no magic food for your brain. There's no magic supplement for a disease. There's no magic food for your brain. All food has nutritional qualities to it that can be beneficial depending on the individual, right? As the old saying goes, one man's food is another man's poison. So we would say, okay, if you're trying to eat foods that are healthy for your brain health, liver, organ meat, regular meat, broccoli, cauliflower, carrots, they're all good for your brain. There's not a magic special food that's better than all the others. Now, if you've got a cone issue in your eyes, Holly, you want to look at vitamin A and carotenoids and antioxidants, because those things can all be super helpful to support your cones. What specific test to check for mold exposure? Mark's asking. I did a show on was it last week, the week before last, on mold, and I went through the different tests. Mark, if you type that in on my YouTube channel, you should be able to find that video, because there's not one specific test. Because there's different, there's mold exposure environmentally, and then there's mold exposure internally, and then there's also whether you have mold allergy or mold infection, or whether you have what's called mycotoxicosis. And so they're all different things, and they're similar but different. And so there's a nuance to kind of ruling one out versus the others. And so that's why it's not, I wish there was just one magic test, but there's just not. It's just like with anything else in life. Very rarely is there a magic bullet that solves the problem. That's why you have to be comprehensive. And that's why our healthcare system sucks, because today most of it is technicians that have been educated to write prescription drugs to appease symptoms. And so it's a very simplistic model. This symptom gets that drug. This disease gets that drug. Because that's what insurance justifies, in my opinion. And insurance is highway robbery. If I had my way, the world would all drop their insurance and revolt, because it doesn't pay for anything really outside of acute care, emergency care. It doesn't really pay for anything that's worth it. When you go to your doctor, and some people say, well, my insurance covers these things. Yeah, but when your doctor doesn't know how to read a lab test, and all he ever wants to do is write a prescription for you, how helpful is that really, if your philosophy is that you won't find the answers in a pill bottle? I mean, that at the end of the day, if you're looking for your answers in a pill bottle, you're never going to find them. So let's see here. RN Walsh, you're a rock star, in case someone hasn't told you. Thank you. I appreciate that. If someone has a pinched nerve in their neck, Soups Chiro would, I guess this looks like probably a typo there. Would Chiro be a good option? Possibly, yeah. I mean, depends on the nature of the nerve pinch. If you have a super severe herniated disc, chiropractic manipulation might not be the best modality to first approach it from. But chiropractors are very multifaceted practitioners. They're not just limited to manipulation. Many of them do traction, which in the case of a pinched nerve could be extremely helpful. Laser therapy might be helpful. Myofascial release. Even some chiropractors that are versed in nutrition could even potentially give you some things that will calm the neck down and calm the muscles down in the neck, or calm the nerve down a little bit, so that you get the pain under better control and the neck can relax, and then you can do better therapy in that relaxed state. But yeah, I mean, there was a study done. I don't remember how. I think it was published in JAMA, and it was a study on the neuromusculoskeletal qualifications of different doctors. And so in this study, they were comparing chiropractors to other professions, orthopedic, neurologists, general practitioners in medicine. And what they found is that from a neuromusculoskeletal perspective and knowledge base, chiropractors crushed all the other fields out of the water. And I believe that, having been trained that way myself. I was recently in the hospital with a family member advocating for their health. And I watched the doctor perform a neurological exam only at my behest, because all they really wanted to do was charge her insurance for a $20,000 CT in an emergency situation, which I said, we're not going to do that. And then I asked them to do an examination. And so then the doctor proceeded to do a neurological exam, and he did it wrong. Like, I watched him do it, and he didn't really know what he was doing. It was very obvious that he wasn't trained adequately in doing a proper neurological examination. So anyway, that was just my experience on top of already published research that shows that chiropractors are a great option for neuromusculoskeletal conditions, and in many cases even beyond neuromusculoskeletal. I have, let's see. So if you have somebody was asking about what to take for joint pain, and I mentioned glucosamine chondroitin and the fact that those have shellfish issues. So if you're shellfish reactive, then you might consider instead SPM, specialized pro-resolving mediators, along with that movement. I have AFib once in a while. If I reduce my thyroid medication, you may have your AFib because of your thyroid medication, Keith. And I can't say for certain, something you want to talk to your prescribing doctor about. But I just had a case yesterday. She had to lower her medicine. We were treating her with diet, and her thyroid medicine became too strong, and her AFib kicked up, and she called her doctor, and they lowered her medication, and her AFib went away completely. So, too much thyroid can be a contributing factor there. And so it's certainly important to know that and look at that if you're on those medications, and have that conversation with your doctor. I was told that I have bursitis and arthritis and a torn ligament in my left hip. The doctor said that I have to get surgery or do some walking and aerobic exercise, or I do some walking and aerobic exercises. You may need surgery, Desiree. It's hard for me to make that kind of determination from the commentary. One of the things that I always encourage people to do when they're facing a surgery is to get a second opinion. And to get a good conservative opinion from a conservative surgeon, or from a conservative musculoskeletal expert who's maybe not a surgeon, like a physiatrist, because they're not incentivized to do the surgery, but they may give you an entirely different opinion. You may not need the surgery at all. When I was a younger, it was like 2 years out. This has been like 22 years ago or so. I'm in the Houston area, so I was running a rehab clinic. I was hired to run a rehab clinic And we had an ortho in the area, and he had a nickname. He was called the Butcher. He had many board complaints, and there were cases where he would operate on the wrong side by accident. He was just inept. And he did surgery on everybody because it was profitable. And we'd get cases that, would come in to see us in our rehab clinic, and we'd rehab those cases, and they wouldn't need the surgery at all. But that was the recommendation that they were coming from. So it's always good to get a second opinion. Never take the first opinion when it comes to surgery. Surgery is not a small endeavor. Even the ones they say that are not a big deal, they're a big endeavor. Look at the fine print when you sign that contract, that waiver, that risk benefit liability form that they make you sign before they operate. Go read what the risks are, and don't dismiss them. They're risks, and you should think about them, and you should think hard about them, and you should ask yourself, is this the risk that I'm willing to take? Is the quality of my life so poor that the outcome of this surgery could enhance or improve it in such a way that it would be worth it? Or is the risk of doing the surgery so great that I'm not willing to take that on? I mean, nobody can answer that better than yourself, but don't dismiss the fine print. A lot of people do. And a lot of doctors do. Oh, we do 20 of these a week. It's not a big deal. Yeah, but how much follow-up are most surgeons doing? I mean, most of the time they get 1, maybe 2 follow-ups with that patient. But fast forward the next year and 2 years and 3 years, guess who gets the follow-up? Doctors like me. We get the surgical follow-ups of all the failed nonsense. What in many cases it wasn't necessary. And so we're cleaning up and mopping up the mess a lot of the times. It's not to say all surgeries are a bad idea. I think they can also be helpful. But going back to what I said, get a second opinion from a conservative doctor, and the likelihood that it will be honest is good if they're conservative. Can a person totally go off Synthroid? Yes. In many cases they can, and in some cases they cannot. Um, that's just been my experience over the years. I've seen, just with gluten-free diets, I've seen well over 1,000 people easily get off of thyroid medication because gluten can cause thyroid disease. And if that is the case for a person, then oftentimes what happens is the medicine becomes too strong with the diet change, and the person starts to have heart palpitations, AFib-like symptoms, anxiety, trouble sleeping or falling asleep, hot flashes, hair loss, weight loss. They basically become hyperthyroid in the face of diet change resolving a disease that medicine was treating. And so you want to go into it with that hope and that attitude. But time ultimately is always the answer as you change your diet and lifestyle. Do you need less medicine? And if you do, take less. But work with someone who understands that. Work with your doctor who prescribed it to make sure you're not, getting off of it, because it's not something you also don't want to just quit cold turkey. It's one of those things. It's important to work with an expert to do the proper titration and monitoring. Doctors have a very different opinion or recommendation for vitamin D for children. What's your opinion? It depends. What do you mean? If you're talking about dosing, it depends on the weight of the child more than anything else. We generally will dose them by weight. So somebody's asking about SPM. Go to my YouTube channel, Freya, and type in SPM crash course. You'll pull up an hour-long show that goes super deep into the science of SPM. And with that, you'll have better understanding and better knowledge about whether or not it's something you want to do. Okay. Let's see here. If you have loose joints and Ehlers-Danlos, what can you do to help support? Simply, you've got to build muscle, because with the laxicity, along with that condition, you need your muscle to pick up the slack. And so, but you've got to be careful about how you go about doing it, because usually with Ehlers-Danlos, you can dislocate joints exercising if it's too aggressive. So working with somebody who understands that to give you a program to help increase your strength. You also need to look at, with Ehlers-Danlos, it's very commonly gluten makes it worse, and sometimes going gluten-free makes it better. B12 deficiency can make it worse, and sometimes taking B12 can make it better. So all in all, a good nutritional evaluation would be one of the best things that you can do, along with strength training to shore up your joints and protect them from the laxicity. Okay, I think it's time. We're well over the time frame. So hey, look, I want to say thank you for those of you who are here today to educate yourself. Do me a favor. We have we have several ways that you can support the show. We don't allow advertisers. I don't allow people to come in and influence my thoughts or behaviors. So we just don't do that. But if you want to support our mission, you can do that in 3 ways. Number 1, you can share this information with somebody you love and help us grow the word of good health and spread this message. Number 2, go visit me at Gluten-Free Society. Sign up there for our free newsletter. We'll send you a bunch of free information about how to navigate diet, lifestyle, and autoimmunity. And number 3, if you're looking for high quality supplements, or even if you're looking for some nutritional testing or to determine whether or not you're gluten sensitive, you can do those things through Gluten-Free Society as well, through our shop. And so, anytime you spend with us, we really greatly appreciate it, because that's what keeps the lights on at the end of the day. It's what allows for my team to help me get this message out to you guys. So appreciate all that you do for us. And we will see you back next week on Tuesday for another crash course, and Thursday again for a live Q&A. Hope you have a fantastic weekend. Take care now.